I'm delighted to be with such a knowledgeable and experienced group. I'm Stewart Mennin. I'm speaking to you from Sao Paulo, Brazil. I've been here for the last 15 years working here and around the world. And I'm delighted to be reconnected with the network. My first experience with the network was in 1985 in Ismailia. And I worked with the network all the way through 2000. And I have lots of experience with it over the years. And I've also worked quite a bit with the Famer Institute, my colleague Bill Burdick, and I have collaborated on many productive collaborations with many fellows. And I've watched Famer Institute grow and expand and influence around the world. And I'm delighted to be with all of you. And my colleague Glenda Ouyang is also with us today. And what I would like to do is I will share screen with you. And I have a short presentation that will address, hopefully, the major issues that have been raised about how we can work globally and locally and make the connections and how it influences faculty development. So I've titled this talk, Hope is Not a Strategy, because it takes more than hope to get things together. You can bring people together and then try to sustain what may happen or try to scale what happens. But unless we have a specific strategy that recognizes the reality, both on the ground, in the middle, and at the global level, we need more than that. And so today I want to use human systems dynamics to close the gap between local action and global policy. And I will explain more about what that is. And my goal today, hang on just 1 second. My goal today is to answer two questions. How can global health policy be put into action in multiple contexts and still preserve the overall coherence of the policy? And how does local action utilize its sensitivity to local and global constraints and still be coherent with locations at other sites and with global policy? I think this is the central question that has been raised by many of you as we move along. And so to have specific objectives for this talk, that during this talk and after this talk, you'll be able to recognize and give examples of simple, complicated, and complex patterns, because it's patterns that we need to move to. We need to move from a perspective of individual events to patterns of events over time. And I will define complexity as simply as possible, and then we will discuss the underlying dynamics of complexity thinking. And that is pattern logic. So if patterns are central to complexity, then the logic of patterns, which is different than the logic model and other kinds of linear logics, is essential for us to be able to use complexity useful and make it work for us. And that also includes a model called this CDE model. And then to get towards action, I will discuss 4 things that influence wicked problems or complex patterns. And finally, indicate how adaptive action makes complexity of wicked problems actionable. It's a tall order, and I will go fast, and I hope that this will work well. So first of all, I want to say that there's many different kinds of patterns. There's art, there's design, there's architecture, there's dance, there's sewing, there's music, there's healthcare, health policy, all kinds of different patterns. And when we look at patterns, we want to understand them in different ways. And so one of the ways to understand patterns is that there are patterns that are simple. For example, taking vital signs or answering a single multiple choice question. There's a right answer, there's a right procedure, there's a best practice in these kinds of patterns. Then there are patterns that are more complicated. They're more variable, they're less predictable, like conducting a vaccination program for school children. And these kinds of patterns are variable and complicated, but there's still fixed procedures that you can carry out. And then there's patterns that are complex. And what does that mean? So if we look at the pattern of a physician with a patient, it's not a fixed protocol that's repeated every time. It unfolds in real time, and it's dynamical. There's discussion, there's relationship. When we look at the pattern of a community health worker working with a family or a pair of families in a rural community, or if we look at a pregnancy unfolding with a patient over time. These are complex patterns. And the way we define complex patterns is that they have similarity, differences, and relationships that have meaning across space and time. So if you look at the village health workers and the families, there are similarities between people in the family, and there are differences. And there are similarities and differences between this family and other families. And there are relationships, and all of these things are moving across time. So it's very hard to pin them down in a fixed time and space. It's the movement across time and space that makes complex patterns so difficult to deal with traditional methods. So it's very important that we focus on patterns. And I want to compare simple, complicated, and complex patterns. And the way we compare them is to look at the complexity of things. Complex thinking looks at parts. There are many, many parts. There are too many parts. How they interact over time and space. And over time, patterns emerge from that interaction. And so if we look at patterns and we use the family in this local village as an example, what we see is that simple and complicated patterns are cause and effect, that they're directly proportional. Input, output, and outcomes are directly proportional. Whereas complex problems, cause and effect, are not linear. They don't allow themselves for direct cause and effect. The outcomes are emergent. And simple and complicated patterns have clear boundaries. You start a procedure, you end a procedure. You begin a project, you end a project. Whereas with complex problems and complex patterns, the boundaries are shifting. They're uncertain. You may have one complex situation co-embedded inside another complex situation, embedded in another one. And so it's hard to discern where exactly the boundary begins and ends. In simple and complex situations like taking blood pressure, there's a beginning and an end. Whereas in family health, working with a village, there's no clear beginning or end. It just goes on. Where in a simple and complicated pattern, there's specific and stable rules. This is where you put the blood pressure cuff. This is the one right answer to a multiple choice question. There are standards and measurements and outcomes that we hold to. We need these. We have to have them. However, in a complex problem like family health or rural concerns, there are unstable rules, changing standards and measurements locally. In simple and complicated situations, there's a well-defined top-down hierarchy. There's a attending physician, there's a resident, there's students, there's fourth-year students, third-year students. The hierarchy is well established, whereas working with complex problems, there's a top-down and a bottom-up. And it's hard to stay with one or the other. You need both. So it's top-down and bottom-up. In complex problems, in simple problems, there's a solution. There's a right answer. This expertise is valuable. We need expertise. We need right answers. And this is best practice. This is evidence-based practice. Whereas with complex problems, there's no right answer or fixed solution. You can't take a solution from one place and put it in another place. And under these conditions, questions and inquiry is the best practice. And finally, in a very simplistic way, simple and complex situations can be replicated. They're precise, they're stable, they're reliable. And we need reliability, and we need precision. There's a huge portion of healthcare that depends on replication. There's a huge aspect of health professions education that wants to replicate prior knowledge and learning. And then there are situations that are unpredictable, and they're filled with surprise and innovation. So the comparison between simple and complex is quite different. And it's very clear that simple and complicated patterns and the working with them does not work with complex situations. So what happens many times is that people try to apply simple and complicated solutions to complex problems, and it doesn't work. And you heard in the introductions from everyone how we seem to be unable to bridge the patterns locally and globally, or that making connections between these things is difficult. And that's because we're using a set of logics and thinking that work really, really well with simple and complicated problems, but not at all in complex problems. And the issue then is to learn the logic and the work of complex problems. And when complex problems arise, they arise through parts, interactions, and patterns. Remember our definition of complexity. A large number of parts held together and interacting so that over time and space, patterns emerge. And the patterns have complex qualities from this table. So the problems that arise are wicked problems, and wicked problems are complex patterns. A wicked problem is any situation that causes difficulties for which there's no obvious, available, and known solution. Any problem that's extremely intractable and massively entangled and complex. So wicked problems are complex, but not all complex patterns are wicked. So we are concerned with the problems that arise in wicked problem situations and complex problems of parts, interactions, and patterns, our definition of complexity. And so it's really important that we understand the logic of complex patterns. And I want to take some time to now go into what is the fundamental logic that is not cause and effect. So how does the logic of complex pattern work? And how does it affect our thinking about wicked problems? How can we make complexity useful? How can we make complexity actionable? How can we apply complexity to the problems that we began talking about? The first thing I want to mention is that there are three components to complex problem logic. And the first component is called the container, and that is the parts that are interacting in a complex system are held together in a container. And the container holds the parts together. And it holds the parts together so that they can interact. And it holds parts together because there's similarities amongst the parts. So many of us here today are interested in health education and health practice. That similarity holds us together. Many of us here online are involved with the network or other organizations that are networking. And a network is an idea, a belief, a system of rules and behavior that holds people together to work together. And that's functionally a container, as if we were inside. And each one of these parts could be a different organization that's online with us here today. They could also be members of a family that are involved with the health worker in a community. It could be departments, different departments in a medical school. It could be a hospital, it could be a community. This could be a different community. This could be a policy, another policy. This could be a different country. All of these parts that have a shared belief, a system, a set of rules are held together by a container. So a container holds the parts together. The differences between the parts create a sense of energy and tension that can be exchanged and released through interaction. So container, difference, and exchange are the fundamental features of a complex problem and a complex pattern. And so it's not the same as cause and effect because this all interacts in a nonlinear way. So what we say is pattern logic, or the logic of patterns, involves containers, differences, and exchanges. So we have many, many parts held together by a container, this blue line, and they interact with each other in nonlinear ways over time and space so that patterns emerge. And the patterns are represented here as ellipses, and one is embedded in the other. And so we see that as agents interact, system-wide patterns emerge. The key point here is that from local agents, interactions in the shared system of beliefs and rules, system-wide patterns emerge. And once those system-wide patterns emerge, they then influence the agents in future interactions. So the logic of complex adaptive systems, of complex patterns, and the logic of wicked problems has to do with parts being held together, being different than each other, sharing differences, communicating, working together, and over time, patterns emerge. And they emerge by a specific process called self-organization, which I'm not going to speak to in this presentation today because this is very abbreviated. So what can we actually do about complex problems? What can we actually physically do on the ground? Here are 4 things we can do specifically to make this actionable, to apply to projects, to apply to policies. 4 things we can do with wicked problems and complex problems. The first thing is called set minimal requirements. These are like global standards, if you will. So a minimal requirement, for example, could be put the family first. Here we have a community health worker, and let's take an example. Let's say this is a vaccination program in this village for measles. Measles is really important right now, and I'm going to use measles and vaccination as a specific example in the rest of this talk because I can't go into other examples due to time. Measles vaccination is important because maybe some of these kids are not vaccinated. If the health worker puts the family first, if the family puts the family first, if the local village puts families first, if the regional health system puts families first, if the national policy puts families first in all its decisions and all its policies, so whenever a decision comes up, the first thing they say is, what about the family? How does this affect the family? And the global policy does this by taking a set of minimal requirements, such as one being family first, and using it, we can link across all global to local. The second thing you can do is don't pretend to know what's happening on the ground. When you have so many individual villages and so many individual countries and so many different places, there's no way that you can actually know what's going on the ground at any 1 minute. So instead of trying to measure and set specific requirements for everybody, you set general requirements, such as minimal requirements, that support local inquiry and innovation. And it makes it possible to know what's happening on the ground by examining the minimal requirements rather than collecting specific points of data and then trying to put them together. Excuse me. A process called adaptive action, which we'll talk about in a moment, makes complexity actionable. So looking on the ground for patterns, on the ground, every context is different. Every family is different, every village is different, every region is different, every country is different, context is everything. However, when you set minimal requirements, the minimal requirements cross contexts and work in context at the same time. And this is the beauty of understanding pattern logic in complexity. Pattern logic allows you to look at minimal requirements, such as put the family first. It works for every village health worker. It works everywhere, and you can look across the whole arc of putting the family first in every context and see the whole pattern. The third thing is to pay attention to the middle scale. In a global policy is top down and local action is bottom up. And very significant to the network's challenge and all the challenges mentioned earlier is to bridge the top and the bottom. And you do this by looking in the middle ground, a middle scale between large global and local scales. Time is up. And actors in the middle scale always follow the same minimal requirements. And this scale could be national, it could be regional, it could be an NGO or a community action group. By identifying and leveraging structures and stories and narratives in the middle scale, the system moves towards coherence between local, middle, and global. And so that's the thing that connects the top and the bottom. And finally, you can evaluate by looking for shifts in patterns rather than only changes in numbers. So we look for, there's no simple evaluation and no single invaluable measure in a wicked complex pattern, because everything is nonlinear and you don't know what's going to be important in the next moment. It's not possible to predict what's going to happen. So instead, you wait and see and look for shifts in patterns at any accessible scale. Valuable information is gained when patterns and structures and stories in the middle scale are leveraged to link with global and local actions. So finally, to make all of this actionable, we use a simple 3-step protocol called adaptive action. And this is really easy to use at every scale by everyone. It consists of 3 questions: what, so what, and now what. And this works in clinical medicine, it works in research, it works everywhere. And it's the simplest approach to all of this. And it's like Kolb's learning cycle. It's even simpler than that, and very deep, and has a strong theoretical foundation. You ask what? What is the discovery process? What's the patient have to say? What's going on in the village? You describe the patterns you see and the patterns you want to see. So you ask, what do you know? It's very common in health professions and community work. What patterns do you see? You're able to describe patterns because you know the difference between simple, complicated, and complex. What surprises you? What interests you the most? What? And there are many more questions, and because of time, I won't go through them. So what is discovery? And we know how to do this. The next question that we ask is, so what does it mean, what we have discovered? It takes us to understanding. It's very much like the 1-minute preceptor. Understanding means explaining interdependencies, implications of patterns. What does a pattern mean? How can you identify, frame, and select viable options for action in a complex pattern? So you ask, what's important here? What are the implications of this? So what is working now? What does it mean? This is a way to understand what's going on. And when you understand what you're seeing, then you're able to take action. And action provides a way to contribute to the change that you seek. So you say, as a result of the meaning I have just made, what will I do right now? What can I do next? What will I communicate? Now what will I measure? Now what action is most likely to help? Now what will you look for? Now what does success look like? These are all familiar questions. There's nothing new and secretive about this. What's different is that these work in complex patterns. These questions will allow you to unravel a complex narrative and a complex situation. And what, so what, and now what is the way to make complexity actionable. You can unravel complexity. These 3 questions are consistently useful at all scales. So it bridges global and local and middle. And it allows you to manage wicked problems and expresses the logic of patterns. And it allows you to turn complex patterns into possibilities of action and possibilities into options for action. So to conclude, progress in life and in science is not a simple line leading to the truth. It's more like progress away from less adequate conceptions of and interactions with the world. And so what we need to do is shift from linear thinking to complex nonlinear thinking, using wicked problems managed by human systems dynamics, complexity thinking that involve inquiry, pattern logic, and adaptive action. So I want to thank you for your patience. This has been a very fast tour through complexity thinking. So the way to do this is to keep learning and to keep going. And I appreciate very much this opportunity.